Before you made this decision to try to lift vaccine mandates for Florida, which include obviously public schools, did your department do any data analysis? Did you do any data projection of how many new cases of these diseases there will be in Florida once you remove vaccine mandates?
Absolutely. So absolutely not. You know, you mentioned whooping cough there. So there's this conflation of the science and sort of what is the right and wrong thing to do.
He said absolutely not. He talks about a conflation of science, but the only conflation happening here is confusing politics for public health. In reality, the right thing to do is always to follow the science when it comes to policies of health to benefit the public. This is like driving blindfolded and saying, let's just see what happens. Public health isn't about let's just see what happens. It's about numbers. When you remove vaccine mandates, you should project how many kids might get sick, how many hospitalizations will rise, and what that means for schools and hospitals. Skipping that step, that's not leadership, that's negligence. And let's be clear about what Florida wants to roll back in 90 days in terms of removing mandates. Chickenpox or varicella, Hep B, Haemophilus influenza type B or Hib, pneumococcal conjugate vaccine, which is the PCV20. With diphtheria, tetanus, pertussis, measles, mumps, rubella, and polio needing legislative approval that may take longer. So harmful, especially considering I had a chemo patient in residency who didn't die from his cancer, but from disseminated chickenpox he got from a classmate who wasn't vaccinated.
So scientifically, you mentioned whooping cough. So that's an example. This is part of the issue with informed consent. That's an example of a vaccine that is ineffective. The data show that it's ineffective at preventing transmission. So sort of mandates with that really don't have anything to do with the notion of transmission.
This is partially true but misleading. Yes, pertussis vaccines don't fully block transmission, but that's not the full story. School mandates still matter because the vaccine protects kids from severe disease and reduces spread to vulnerable people at home. Most children who complete the series stay immune for at least 5 years, with effectiveness above 75% in young kids and about 65% even 5 years later. Vaccinated kids are far less likely to get seriously ill and less likely to carry whooping cough back to babies, grandparents, or anyone with a weak immune system. So while the shot isn't perfect at stopping every case, it's a critical layer of protection for the child, the classroom, the entire household, and community.
And then in terms of, like analysis, well, ultimately, this is an issue very clearly of parents' rights. So do I need to analyze whether it's appropriate for parents to be able to decide what goes into their children's bodies? I don't need to do an analysis on that.
He says, I don't need to do an analysis on that. Oh, really? Because in public health, that's literally the job. Analyzing risk and protecting communities. Saying you don't need analysis is like a pilot saying, I don't need to check the weather routes before takeoff. Spoiler, that doesn't end well. When kids enter schools and group settings, it stops being just about my body, my choice. Public health is about protecting communities. Letting parents skip vaccines without consequence is like saying, my body, my car, my choice, so I'm going to drink and drive. No, because you put everyone else on the road at risk. As Dr. Paul Offit has said, vaccines are victims of their own success. You don't see polio, diphtheria, or Hib meningitis anymore because of school vaccine programs and vaccine programs in general. Now the idea is to lift mandates because these illnesses feel invisible. This doesn't bode well. School mandates help keep these diseases in check. Remove them, and it's only a matter of time before we see them return.
You're trying to lift the vaccine mandate in Florida, and your department and you did not even do a projection as to how this could impact public health. So you have not prepared hospitals in the Florida counties most at risk with the best treatments for any outbreaks of measles, mumps, rubella, whooping cough, polio, and you have not looked into how many kids might now get these preventable diseases.
Trying to lift mandates without projections, no prep for hospitals, no analysis of how many kids will get sick even with the best treatments. Here's the thing. Outbreaks don't just hit hospitals, they ripple through entire communities. Schools close, parents miss work, and healthcare workers get slammed. Florida's health and education systems are already bursting at the seams. Doctors and nurses are leaving in droves, as well as school administrators and teachers. And when those preventable outbreaks come, are you going to cover the hospital bills, the parents' lost wages, the litigation school systems will face when a child gets a vaccine-preventable illness because there were no guardrails in place? Of course not. This is exactly what happened during the pandemic. Politicians made the decisions and the fallout landed squarely on the backs of families, healthcare workers, and schools. Skipping the math isn't just sloppy, it's reckless.
What I'm saying is that it's an issue of right and wrong in terms of whether parents should be able to control, have ultimate authority over what happens to their kids' bodies.
Parents do make choices, but public health sets boundaries when those choices put others at risk. Florida's kindergarten vaccination rate is already below the national average. Every year, I see kids who only start vaccines because the school requires it. Remove that requirement, and coverage is going to plummet. And when coverage drops, herd immunity collapses. Think of it like a chain link fence. Every vaccinated person is a link. A missing link here or there, the fence still holds. But take away whole panels, and the fence falls apart. Diseases are going to walk right in. At that point, it's not just about your child at risk. It's the newborn at home, the kid with leukemia, the pregnant teacher, and grandparents. Communities pay the price when mandates disappear. And as a pediatrician, I care about all kids. Fully vaccinated, partially vaccinated, too young, medically exempt, and yes, even those unvaccinated by choice. Herd immunity is what protects us all.
And in terms of outbreaks, we do have outbreaks in Florida, just like every state, and we manage those. So there are no new special procedures that need to be made.
Right, but you're talking about doing something that no other state has done.
We manage them just as always.
But you're talking about doing something that no other state in the United States has done and removing the vaccine mandate for public schools. You're making a decision that no other Surgeon General in the United States has done. It goes against what's recommended by every top medical organization.
Yeah. He says Florida has outbreaks just like every other state, and we manage those. No new procedures needed. Except Florida is now choosing policies that invite more outbreaks. This is something that's not being done in any other state. And let's not forget, this isn't just about Florida. Millions of tourists pour into Disney, beaches, and theme parks every year. Diseases travel and add international travel, and this is going to be a huge concern. Rolling back mandates is basically rolling out the welcome mat to chickenpox, hip meningitis, and pneumococcal infections. Here's the truth. The right thing to do is to protect kids and communities with proven science. Vaccines aren't new, especially the routine schedule. I have no problem revisiting the schedule and looking at its need, but it needs to be guided by public health officials and science in mind. The wrong thing is ignoring data, shifting the fallout onto schools and hospitals, and calling it parents' rights. And the concerning part in America, states are splitting into two camps. Blue states tightening protections, red states stripping them away. It's turning into a civil war of public health. And the cruel irony, many of the same red states leading the charge already struggle with higher rates of chronic illness, worse access to care, and weaker health infrastructure. They're the least equipped to handle preventable outbreaks, yet they're the ones dismantling the guardrails. At the end of the day, when political theater, which is what this is, overrides science, families, teachers, and doctors are going to be the ones left holding the bag. Vaccines have already given us the blueprint. Safe kids, safe schools, safe communities. Ignoring that isn't just bad policy, it's bad math that just wasn't done by the Florida Surgeon General and his team.